Hello, I'm Michael Biamonte. I'm a New York State certified clinical nutritionist. For 18 years, I've studied the effects of Candida overgrowth on the human body and how Candida interacts with various treatment plans. With that knowledge, I've developed the Biamonte method of Candida elimination, the most successful and comprehensive program available today. The Biamonte method of Candida elimination divides treatment into 4 phases. Candida must be eliminated or stripped out of the body in layers due to the different stages of growth it undergoes and the different underlying causes that allow its growth. An effective Candida treatment program ensures that Candida is not just eliminated, it also corrects underlying imbalances, deficiencies, and toxicities that could cause the Candida to return if left in place. My experience is that practitioners concentrate on only one of these 4 phases and neglect the other 3. This is why treatments fail. The Biamonte method first eliminates the Candida infection. Second, detoxifies the intestines and the body. Third, corrects hormone and nutrient deficiencies. And lastly, supports and rebuilds the immune system so the entire cycle doesn't happen again. For more detailed information on these phases, please visit our website at www.health-truth.com. Self-treatments fail because they exclusively rely on symptoms to judge progress rather than a biochemical test, which can be more objective and more detailed. An accurate test to determine if the program is working and also to determine when desired results have been achieved is the cornerstone of the Biamonte method. Our test precisely measures the rate of Candida die-off and shows when it's fully eliminated. It is our guide throughout the program so that we do not stop treatment too soon, causing the remaining Candida to grow back, and so that we do not continue to treat the patient after the Candida has been eliminated. One critical factor in the testing process is the testing of first morning urine. It is also essential that the test be administered within 1 hour of voiding. If the urine is not tested within the first hour, chemical reactions will occur that lower the accuracy of the test results. Because of these factors, we've created a simple and effective test kit that can be self-administered in the privacy of your own home. This test kit can be purchased through our center and comes with detailed instructions and colored charts that guide you through the process, allowing you to see your test results immediately. Bacteria, yeasts, and parasites produce organic acids unique to themselves and not naturally occurring in our own bodies. These chemicals serve as footprints of these organisms. Our test measures these waste products along with waste products created by Candida's own metabolism. Free radical reactions that occur from the alcohol produced by Candida are also measured by this test, creating a comprehensive evaluation of the patient's condition. As I consult with new patients, I hear similar stories with respect to previous treatment plans.
My doctor gave me an antifungal. He said it was very good. I took it for a few weeks and I was feeling much better. My symptoms were almost gone. I thought I was cured. Then suddenly all of my symptoms came back. I was still taking the same medication. I hadn't changed anything.
That's precisely the problem. They didn't change anything. Like a chameleon, Candida is able to transform itself from a fungus to a yeast. It is highly resistive and may be able to mutate against an antifungal herb or medicine if it's taken 21 days or longer. The Biamonte method combats this resistive nature by choosing remedies specific for the patient's condition and then rotating these remedies once every 4 days until the Candida has been eliminated. A commonly prescribed medicine for Candida is nystatin. According to the physician's desk reference, no detectable blood levels are found following oral administration of the drug at recommended doses. This makes the drug effective at reducing localized vaginal or intestinal yeast growth, but cannot travel through the bloodstream to handle infections in other areas. Another drug, Nizoral, impairs the production of a vitamin D-like substance, which is vital to the integrity of the yeast cell membranes. This drug is difficult for Candida patients to assimilate due to their low levels of stomach acid. Low stomach acid is a common underlying cause of yeast infections that often masks itself as indigestion. Recent evidence shows Nizoral may cause serious liver damage or even fatal reactions. The PDR states that these drugs can only be taken for a short period of time due to toxicity. It is my opinion that they cannot be taken in a long enough duration to kill Candida. Another common yet ineffective medication is acidophilus, which is a probiotic available in health food stores. Acidophilus can reduce some Candida symptoms if used regularly, but only after the Candida has been eliminated and the intestinal tract is relatively clean. Most patients experiencing symptoms already have Candida overgrowth, which will choke out any acidophilus introduced into the body. Certain vitamins and minerals can spread Candida. Some of these include vitamin B complex, vitamin D, coenzyme Q10, calcium, copper, and iron. Many of these nutrients protect the Candida from the very medicines used to eliminate it. Antifungal agents work by creating oxidative stress against the membrane or the outer skin of the Candida. Antioxidant vitamins in high doses will protect the Candida from these nutrients and render the treatments ineffective. Most prescription drugs work by blocking the absorption of nutrients like vitamin D or iron into the Candida cell, so that the Candida will not get the nutrients it needs to nourish itself. So it would not make sense to feed the Candida these very nutrients it needs to thrive by taking vitamin supplements. Additionally, giving a toxic body dozens of nutrients can cause an adverse reaction. Vitamin supplements can cause an uncontrolled release of toxins, shocking the body and causing some patients to become severely ill. Of course, once Candida has been eliminated, patients can resume taking supplements. Having elevated levels of estrogen and cortisol, or having lower levels of testosterone, DHEA, or progesterone, can make a man or woman more prone to Candida and cause continual relapse. Women who notice their Candida symptoms worsen during the PMS phase of menses, or men who have noticed they have a drop in energy or libido since developing Candida-like symptoms, have hormonal problems linked to Candida. Stress will easily cause Candida by elevating the stress hormone cortisol, which depresses the immune system and, like estrogen, raises the amount of sugars found in the mucus surrounding the Candida. Toxic metals such as mercury, copper, iron, aluminum, bismuth, and arsenic show up consistently in Candida patients. These metals can disable the exact part of the immune system that seeks to control Candida, and they can also destroy the gut flora that restrains Candida overgrowth. Many doctors make the mistake of aggressively chelating or trying to remove these metals from the Candida patient early in the treatment, thinking that handling the cause will clear it faster. But this only serves to spread Candida. As the huge outpouring of metals move down the intestinal tract, they contact and spread the yeast. Removal of these metals must be done after the Candida is eliminated. A common self-treatment for Candida is the low-carbohydrate diet. While this may temporarily relieve Candida symptoms, it is not an effective treatment. Candida nourishes itself by establishing a root system that taps into your blood vessels and feeds on blood sugar and other nutrients. There is always enough blood sugar present to keep Candida nourished, regardless of eating a low-carbohydrate diet or even fasting. Fasting cannot kill Candida. When you fast, your body must keep a normal level of blood sugar circulating so that your brain and muscles continue to work. Therefore, it also continues to nourish the Candida. However, a low-carbohydrate diet weakens Candida. Much like a weed which has had little water for some time, even when it's barely alive, it can continue to survive, and if watered and fed properly, could grow again, returning to its former glory. This is a very important concept to understand when we consider the importance and the place the diet holds in the elimination of Candida. At the Biamonte Center, the Candida diet is used to weaken the Candida by starving it. This makes it more susceptible to the anti-yeast and antifungal substances that we use. We have 3 different diets to choose from with our Candida treatment program. Diets are chosen based on individual needs. We also customize diets as needed for patients with other health issues such as diabetes. Candida overgrowth is a tenacious condition that requires a systematic method of eradication. The Biamonte Center understands the importance of not only eliminating the Candida, but also correcting the underlying imbalances, deficiencies, toxicities that could cause the Candida to return. The Biamonte method first eliminates the Candida infection. Second, detoxifies the intestines and the body. Third, corrects hormone and nutrient deficiencies. And lastly, supports and rebuilds the immune system, giving the patient's own body the resources necessary to combat future overgrowth. This is the solution and the correct path to handling this modern scourge. I wish you well.